Welcome to the opening of CAHA's annual Greening the Healthcare Sector Forum. We are so glad to have you joining us today. I'm Dr. Aletha Ward. I'm a proud registered nurse, climate and health educator, researcher, and also CAHA board member. And it is such a privilege to host the opening session of the Greening the Healthcare Sector Forum this year. I am joining you from the beautiful lands of the Turrbal and Yugara Hills. We've got quite a bit of a lineup this morning. We have Assistant Minister Jed Carney, who will be presenting very shortly as well. And we also have a great panel session ready for you, and really excited to have some just exceptional speakers joining us this morning. This is obviously the first session of this year's forum, kicking off 2 weeks of knowledge and sharing and great discussions. And a shout out to Bupa Australia, who is the platinum sponsor of this year's Greening the Healthcare Sector Forum. Their support has certainly enabled us to bring this virtual event to you today, and we look forward to hearing from Bupa shortly. The theme of this year's forum is accelerating collective action for sustainable and climate resilient healthcare. The 6 sessions and 3 workshops over the next 2 weeks will emphasise the need to reshape the future of healthcare and climate action through our collective efforts. So we hope these sessions will really provide rich learnings, connection and inspiration to bring about change in your own circle of influence. So being a completely virtual event, there are a few features we want to highlight to ensure that you get the most out of this interactive experience. So we might hit the housekeeping first, just to make sure you know where everything is. So at the bottom of the screen, you will notice there is a discussion forum, and we encourage you to share your reflections and thoughts throughout this session with other attendees in the discussion forum. So I've noticed, Rachel, you've got a little question in there, and our moderators will answer that for you. Thanks, Rachel. A reminder that this session is being recorded, and this session and the other sessions will be available later via the platform for 4 months post events. We would love to hear your thoughts and reflections on today's session. So we'd encourage you to tag us. So you can tag us at healthy_climate on Twitter, or Climate and Health Alliance on LinkedIn, or use the hashtag GreenHealthForum24. And over the next hour and a half, we're going to set the scene for our annual forum. But I see that I believe we've now got Nartarsha with us. So Nartarsha, it's my pleasure to introduce Nartarsha for our acknowledgement of country. Nartarsha is a proud First Nations woman and the founder of Queen's Acknowledgement and Indigication. So Nartarsha is a speaker, Indigenous facilitator, community leader and mentor. But the title she's most grateful for is being a mum to her 2 beautiful boys. So Nartarsha's work is about modelling the importance of connection to self, culture, country and community. Nartarsha works through storytelling, language, music, dance and movement to bring awareness, acknowledgement and empowerment to her audiences. Her work focuses on integrating First Nations culture and history into our everyday lives and business practices. And Nartarsha aims to foster growth, progress, and a commitment to leaving this place better than we found it. A very warm welcome, Nartarsha.
Hello. Hi, everyone. Hello. So great to be here after it not, all the connections. Making it difficult this morning, but that's okay. I'm here. So thank you so much, Aletha and the team, for all of the hard work behind the scenes. Would like to really bring presence into this moment to acknowledge the beautiful country of which we're all tuning in from. I am speaking to you from Naarm, Kulin Nations, the Wurundjeri people, and I want to extend that to all of the lands here across Melbourne and Naarm and the lands and waters and skyways. We have the Bunurong, Bunurong, Tanarong, Djajarong, and Watharong people. I want to extend that acknowledgement to all of the elders and First Nations people that are here present with us all today, and the lands on which you're all tuning in from, listening, connecting, learning, being inspired, and continuing to grow in this space with one another, with the knowledge that you'll be hearing and sharing with those about this conference. So I want to extend the acknowledgement of all the lands, the waters, the skies, the animals and plants, the culture, the people, the ceremonies, the traditions and practices that have taken place on these very countries. I want to acknowledge all of the journeys of those that have travelled across these lands from all walks of life. And I want to say in my native tongue, as I was born and raised and come from the Murray River on Yorta Yorta country in the nations, where I spent time along the river, the gum trees, and allowing the water flow in between the lands from the fresh waters all the way out into the salt waters of where I now get to call home. I say to you all, Ti galinyan ganya, nia na kakayawa yambina waka, nia na kaya yambina yakarumja, dumanya gumiga dumiga itha waka nida wamandaman imalan. Mumabangara boma inan waka, ganan yakarumja, wutunarana. I said, hello, beautiful friends. We walk upon the land of the Aboriginal people. We thank, acknowledge, and respect the Aboriginal people's land that we gather on today, taking pleasure in all the land and respecting all you see. And I want to extend that acknowledgement to those that are across the seas, to our sibling country here. Also, we have New Zealand. I'm pretty sure that's right. So I want to extend that to the brothers and sisters and the traditional custodians of those lands, and acknowledging the culture that extends through the languages and the way that we connect, especially in this day and age, bringing us together and keeping us connected in a modern way, but acknowledging the ancestral wisdom that continues to take place and ripple through into today's practices in how we work and live, and acknowledging this land. I want to sing to you a song of calling of country as I finish off for you. Oh, Gamina waka, Gamina waka, Gamina wala, Gamina wala, Gamina tatula, Gamina tatula, Gamina imbina, Gamina imbina. Chup, chup. Awakening all that surrounds us of this Mother Creator, the earth, the waters, the skies, and the people. May you continue to journey on this time and this place in connection with one another, learning and growing and supporting and being guided in your time, and leaving this place better than you found it in how we show up and be present with our acknowledgements. Thank you.
Nartarsha, thank you so much. What a beautiful acknowledgement of country. That was well worth the wait in the systems issues, which I believe we've ironed out now. So sincere thank you for that. So the next 1.5 hours, let's jump into it and we'll set the scene for our annual forum. So first up, we'll hear from CAHA's CEO, Michelle Isles, who will share the wealth of progress and lessons learned after, can I say, a very busy and productive 7 months in the role. Welcome, Michelle, to deliver the welcome address.
Thank you so much, Aletha. It's terrific to be with you all here today. And I just wanted to say a heartfelt thank you to Nartarsha Bamblett, a proud Yorta woman whose ancestors and line have many leaders, community leaders, who have shown us ways of collective action, have shown us self-determination and how to safeguard cultural strength, health and well-being for community. I want to acknowledge that I'm here on Bunurong country, which is in the south of Victoria in Australia. I want to acknowledge the deep cultural history of this place, the truth-telling that has strengthened our community through shared understanding, and the generosity of elders who guide better ways to live with country. I acknowledge CAHA's President Lynn Oak, our esteemed speakers. We've got such a terrific lineup today in this opening plenary, but also to follow. We have Aunty, Professor Doseena Fergie OAM, Professor Fiona Stanley. We have Roger Sharp, Chief Sustainability and Corporate Affairs Officer at Bupa. And thank you to the Bupa team for backing our vision for this event. Thank you to Deanna Picon Manyari from Healthcare Without Harm for making yourself available, to Dr. Kate Charlesworth, and of course Dr. Aletha Ward for hosting us here today. CAHA members, supporters, health champions across our region, thank you for being here. So we come together with purpose to accelerate collective action for sustainable and climate resilient healthcare. We are diverse. We come from urban and remote regions, different cultural contexts. We represent many different health professions, public, private. We have deep experience in sustainable healthcare, or we are new to climate and health. It is this breadth of experience and depth that excites me about the conversations, learning and action that will happen over the next 2 weeks. So why must we accelerate action? Well, as world leaders gather in Baku this week for the 29th Conference of the Parties meeting on climate change, they meet amid a backdrop of record-breaking temperatures and climate events that threaten life as we know it. Today, we are watching ferocious fires in Queensland's Gulf country. The cause of climate change, the burning of fossil fuels, is increasing the burden of disease, with many First Peoples communities on the front line of exposure and advocacy. We are in a health emergency, and as our colleagues at the World Health Organization put it, health is the argument for climate action. Scientific evidence combined with health evidence to act now is irrefutable. Australia's latest biannual State of the Climate report shows 8 of the 9 hottest years in Australia have occurred since 2013. This has led to increased heat stress, longer fire seasons across the country. In Aotearoa, New Zealand, extreme weather events such as those leading to floods and slips in Auckland, storms in Westport and Nelson, and droughts across the country are becoming more frequent. Our Atmosphere, our Climate 2023 report documents grave concerns about multiple severe weather events that overlap in time and space. We know this to mean our communities and health systems are increasingly under pressure. We have deep and worrying questions to ask about how we build resilience and the extent to which we can adapt. Climate change is, after all, a threat multiplier. It can undermine our efforts to progress health outcomes, and therefore we need to embed climate change scenarios in our health planning and through models of care. This action will save lives and save costs to our health system. We also need to run at the cause, use our trusted voices to name fossil fuels and plastics as health hazards, and where we have influence, embed health in all policies. If we prioritised health risks in our decision-making about energy, transport and procurement, we would make decisions that could benefit current and future generations. To gain the necessary trust, we also must act to reduce the environmental impact of healthcare. We have an opportunity to improve the value of care we deliver within health systems through efficiency and efficacy, and with a focus on environment and community as context to person-centred care. It is, however, extraordinary to reflect on our shared progress to build a health movement. For example, in 3 years, CAHA's membership has grown from 45 organisations to over 100. And since November 2021, we've introduced over 700 hospitals and health services to the GGHH program. That's an incredible number. We've had clear policy signals from our national government. Australia, New Zealand and Fiji have joined the Alliance for Action on Climate Change and Health, known as ATTACH. This time last year, Australia released a national health and climate strategy, an output and outcome that CAHA members worked for and advocated for many years. We were buoyed to see that Te Watu Ora, Health New Zealand and the Ministry's Public Health Agency released a dedicated health and climate plan in October, which will build climate resilience into the health system and beyond. So we have solid foundations to accelerate action, and as we say at CAHA, together we are powerful. I hope the 2 weeks ahead build our shared knowledge and strength for a fruitful 2025. Thank you for joining online. We are social beings, and yet the scale of the issues we face cause for us to pause and reimagine the way we work together. A shout out to our group viewing rooms in hospitals across our region. I'm proud of our small and mighty team and incredibly grateful to our advisory committee and esteemed speakers who together have created an exciting and rich program. I encourage you to immerse yourself in the 2-week program, panel sessions, workshops, featured videos on campaigns, posters with leading case studies, and of course the networks of leaders, change makers and those coming to this challenge fresh. Connect with each other, share ideas and make a plan for how you will apply your learnings in your unique context and within your spheres of influence. Thank you.
Thank you, Michelle. Some really important insights there, and I think particularly around our shared progress. Whilst there's so much more to do, it is important that we don't lose sight of what we've actually achieved already. So thank you. I'm now going to pass over to our platinum sponsor, Bupa, who will deliver a presentation on Bupa's commitment to sustainability. It is therefore my pleasure to introduce Mr. Roger Sharp, Chief Sustainability and Corporate Affairs Officer of Bupa. Roger has been responsible for developing and leading the implementation of Bupa's sustainability, communications and stakeholder engagement strategies since 2019. Roger is a strong believer in driving progressive change whilst ensuring care for our people, planet and communities. Over to you, Roger.
Thanks so much, Aletha, and also a huge thank you to Michelle and for the opportunity for Bupa to be able to sponsor the CAHA conference today. I would also like to acknowledge the beautiful acknowledgement from Nartarsha earlier, and also extend my respects to the Wurundjeri Wurrung peoples of the Eastern Kulin Nation, from whose lands I'm joining you from today. Also, a special shout out to any fellow Kiwis on the call today. I believe we've got some teams from New Zealand joining us today. Like most people, I'm sure, joining this forum, at Bupa, we're seeing an ever increasing impact of climate change on people's health. It's changing our communities, it's changing the landscape of healthcare. And yet, surprisingly, I'm still asked by many people, why is Bupa so interested in sustainability and why are we taking action to sponsor conferences such as today? For me and for a health and care company like Bupa, it's really quite a simple question. Put simply, we can only deliver on our purpose of helping people to live longer, healthier, happier lives if we are also striving to make a better world and a better environment. Because ultimately healthy people really do need a healthy planet. So human health is intrinsically linked to the quality of our environment and the health of our planet and its ecosystems. And of course, the best way to achieve success in these areas is by working together. That's why we're so pleased to be the platinum sponsors for Greening the Healthcare Sector Forum conference over the next couple of weeks, hosted by CAHA and with Healthcare Without Harm's Global Green and Healthy Hospitals Network. Globally, Bupa has signed a partnership with Healthcare Without Harm, and we want to work together to address some of the biggest sustainability challenges within the healthcare sector. Over the next 3 years, we're committed to working across Europe, Latin America, and the Asia Pacific region to accelerate the transition to sustainable healthcare. And in many ways, this conference represents the starting point of what I hope will be a strong and effective partnership working with CAHA in the Asia Pacific region, but also with many of the other people involved in the forum today. I'm sure it's not new news to people on this call that approximately 4% of the world's annual emissions are generated through the provision of healthcare, and that in Australia, this actually rises to roughly 7% of our country's total annual carbon emissions. So when we find ourselves in a situation where the care that we now receive to keep us healthy is also contributing to changes in our environment that will make us unhealthy in the future, we need to do something. And so at Bupa and with many of our partners in the healthcare sector, we're very much and increasingly aware of the role we're playing in the production of these emissions and our responsibility to take action. Many of you will know Bupa as a health insurance provider in Australia, but we're also the largest private dental provider, one of the largest aged care providers in Australia, an aged care provider in New Zealand, and the second largest health insurer with over 4.5 million customers. Globally, our business provides health insurance and health services to 50 million people. We operate 370 health clinics, 20 hospitals, 1,000 dental centres across the globe. So we have a role and a responsibility to play our part in reducing the environmental burden our sector and our business is putting on the world. We've started to act and we're going to continue to do so. Globally, we've made a commitment to science-based targets to be a net zero business by 2040, and we're currently on track to reduce our direct scope 1 and 2 emissions by 78% versus our 2019 baseline. Our Asia Pacific operations are powered by 100% renewable electricity, and we're making good progress on reducing other forms of direct emissions, such as refrigerants from our air conditioning, cooling systems in our aged care business. We're also taking action on scope 3 and indirect emissions through sustainable investments, technology emissions through the use of flexible cloud platforms, and through supply chain and procurement strategies. And we want to help others in the healthcare sector become more sustainable by investing in new solutions and supporting innovation and startups through our eco-disruptive program. So we've got a range of programs underway with clear targets to reduce, to switch to less environmental burdensome products where we can, and to switch out single-use clinical items and devices. We're also trying to help our patients reduce their carbon footprint by switching to more digital health platforms, including through our new customer-facing platform, Blua. Through Healthy Cities, we've helped a number of people in our business and through our partners get active while also unlocking millions of dollars this year and last year for environmental regeneration and biodiversity programs, and we've got more to come on that front. Healthy Cities not only leads to more trees and plants and biodiversity, but it also creates longer-term healthy habits in the people involved in Healthy Cities to be active and therefore reducing the need for healthcare, because the lowest emission healthcare is actually the healthcare that doesn't need to happen. Finally, in our partnership with CAHA, we're also one of 15 founding members of the Monash Sustainable Development Institute's Transition to Sustainable Healthcare Consortium. The MSDI team have brought together voices of policy, practice, research right across Australia's public and private health systems. Of course, there's more that we'd like to do, but like many of you, we're currently working through some of the challenges around specific products and services and better ways of working that are important for our environment. But it's through conversations and conferences like this and the networks, the partnerships and the collaboration that takes place that I believe the solutions will be conceived. We've got a great session tomorrow where I'll be joining Michelle about health systems in a warming world, and we'll also be involving our Clinical Director for Health Services, Tony McDermott, in that discussion. So finally, thanks again to CAHA, especially to Michelle and the CAHA team for being the sponsor of this conference. It's a commitment we look forward to maintaining over the coming weeks, months and years, because all of us in the health sector have a responsibility to do more and to solve some of the problems that face our planet, our communities and our sector. Thanks so much and look forward to a really interesting forum. Thank you.
Thank you, Roger. It's really wonderful to hear Bupa's commitment, and certainly healthy people do need a healthy planet. So thank you to you and the team at Bupa for your support of this forum. And thank you to our forum participants for thoughtfully engaging in our discussion forum there. I see some insightful comments that have been added already. So next up, it is my absolute pleasure to introduce the Honourable Jed Carney, Assistant Minister for Health and Aged Care and Indigenous Health, who is joining us via video today, recorded specifically for this forum. Jed trained as a nurse and a strong advocate for the health workforce, and has been a champion for climate and health from the early beginnings of CAHA about 14 years ago now, and is now overseeing the delivery of Australia's National Health and Climate Strategy.
Well, hello to all the health leaders at the virtual Greening the Healthcare Sector Forum. Thanks for inviting me to speak to you today, and I'm really sorry I can't be there with you live. But I'd like to begin by acknowledging the traditional owners and custodians of the lands on which I'm recording this message today, the Ngunnawal and Ngambri peoples. And I pay my respect to elders past and present, and extend that acknowledgement to the traditional owners of all of the lands from which you are joining this forum today, all around Australia. Thank you for inviting me to open the forum, and to the Climate and Health Alliance for putting this event together. The Alliance has been a leading light in healthcare sustainability and climate and health advocacy in Australia for many years now. It's been instrumental in advocating for both the development and implementation of the National Health and Climate Strategy. I personally am very proud to have been a founding member via my time in the leadership of the Australian Nursing and Midwifery Federation, working at that time with the formidable Fiona Armstrong. But this is a great opportunity for like-minded people to share knowledge, skills, and to learn from leaders in sustainable healthcare. I look forward to continuing to work together towards a shared goal of healthy, climate-resilient communities and a high-quality, sustainable health system. I'm so pleased that the Climate and Health Alliance is represented on the Climate and Health Expert Advisory Group that I chair. I look forward to our next meeting actually in a few weeks' time. Now, we all know how serious a threat climate change poses to the health of our communities and our health system. The most recent State of the Climate report, published just a few weeks ago, has shown alarmingly that Australia's climate has already warmed by an average of 1.51 degrees since national records began. Unfortunately, our health system is currently responsible for around 5.3% of Australia's national greenhouse gas emissions. Like so many of you in this room, I care deeply about ensuring that the health system plays its part in reducing Australia's greenhouse gas emissions and helping move our whole economy towards our goal of net zero emissions by 2050. A key focus of mine is a health in all policies approach to policymaking. I want to always ensure that we are thinking about the relationship between health and climate outcomes. A key initiative that frames our health in all policies approach is the National Health and Climate Strategy. Now, it sets out a whole of government plan over 5 years to address the effects of climate change on health and to reduce the contribution of the health system to Australia's greenhouse gas emissions. Since I launched the strategy at COP28 in December last year, I'm very pleased to report that we have made good progress. Work has begun on 31 of the 49 actions within the strategy, with 11 of those 31 actions completed or in their final stages. And today, I have a hot off the press announcement for you all. You're the first ones to hear. I'm very proud to announce that we have just published a review of current Australian research on climate and health in Australia. This report summarises existing Australian climate and health research, identifies gaps, and makes recommendations about future climate and health research priorities. Research is vital to addressing the impacts of climate change on health and health systems. Mapping the current research and pinpointing where any future funding could be most usefully directed is a key part of delivering on the National Health and Climate Strategy. You can find the review now on the Department of Health website. I hope that it will be useful to many of you in the room who are working in climate and health research, in policy and practice right around Australia. This is just the first in a series of reports that we are very close to publishing, including an estimate of Australia's health system emissions. These will act as a baseline against which we can measure our progress towards sustainable health systems. Meanwhile, several other key pieces of work are underway. In partnership with the Australian Commission for Safety and Quality in Healthcare, we are convening a multidisciplinary working group to develop a framework for collaborative action on climate and health. The group will include representation from nursing, allied health and medical colleges. Their focus is embedding climate change training in clinical guidelines. Many of you will be pleased to hear that the department is working on a health national adaptation plan and resources to support risk assessment and adaptation planning at a local level. And finally, I am very proud that the Albanese government is committing $251.7 million to establish a standalone Australian Centre for Disease Control. It was a key election promise and we are very excited to be establishing it. The CDC, as it will be known, will bring together critical information and leading expertise to deliver better health advice to governments and to improve health outcomes for all Australians. It will consider and adopt modern surveillance and data analytics tools to enhance Australia's preparedness. I wish you well in your forum deliberations over this week, and I look forward to hearing the outcomes of the meeting and continuing to work with you all towards a healthier Australia. Thank you.
It was wonderful to hear from Assistant Minister Jake Carney with those insights there and news, which is excellent. I'm really excited to move on to our panel discussion because we're very, very fortunate to have an incredible lineup of health leaders. So I'll go through and introduce our panel members. We're just having a few connection issues with Aunty, Professor Doseena Fergie, so I'll introduce her shortly, but I'll start with Professor Fiona Stanley, who no doubt you already know, and is the founding director, patron of Telethon Kids Institute, a unique multidisciplinary independent research institute focusing on the causes of and prevention of major problems affecting children and youth. Professor Stanley is a distinguished research professor from the University of Western Australia, an honourable professorial fellow. It's a tongue twister, Fiona. University of Melbourne, and UNICEF Ambassador for Early Childhood. Trained in epidemiology and maternal and child health, Fiona established population data sets in Western Australia, including registers of major childhood problems, championed record linkage, and pioneered First Nations leadership in research. And of course, as you would know, Fiona was named Australian of the Year in 2003. So very, very fortunate to have you with us, Fiona. Welcome. We've also very, very fortunate to have Kate Charlesworth with us. And Kate is a public health physician in Sydney and leads the Climate Risk and Net Zero Unit at New South Wales Health. The unit is tasked with coordinating New South Wales Health's transition towards a modern, high-quality and low-carbon health system. Kate is also an expert member of the Climate Council, leading on evidence-based climate communications. And lastly, but not least, we're very fortunate to have Diana Manyari with us as well today for our panel. Diana is a public health professional with almost 25 years of experience working in international organisations focused on monitoring, evaluation, learning and management roles in climate resilience, food security, infectious diseases and immunisations. At Healthcare Without Harm, Diana leads the international climate team, leading the organisation's work supporting the health sector at a global level in climate change mitigation and adaptation efforts, policy and advocacy. Oh, wonderful. So good to see you, Aunty. I will also introduce to you Aunty Professor Doseena Fergie OAM, who is an Aboriginal and Torres Strait Islander elder who lives on the Boonwurrung country in Victoria. Aunty has a PhD in nursing midwifery research and practiced clinically in an Aboriginal community and lectured in first people's health and well-being. Aunty Doseena has founded Aboriginal organisations, established First Peoples Voices in health services, and mentored Aboriginal and Torres Strait Islander health students to become professionals delivering culturally safe care throughout Australia. So welcome all. As you can see, we've got a very high calibre panel with us this morning. So what we might do to kick off our panel session is I'll invite each of our panellists to reflect on the following question. Maybe just give us your initial thoughts. So the question is, what does a healthy, regenerative and just future look like for you? And what barriers, therefore, do we need to overcome to achieve that? And what role do we as healthcare leaders play? So we might start with Diana. What are your thoughts in regards to that question, Diana?
Thank you so much for that, Aletha. And first of all, thank you to CAHA and the organizers of this event for inviting me to be in such a great panel with such wonderful, powerful women leaders in this sector. I think that to answer your question, I feel like we need to sort of go back to the basics. We know that good health and quality of life are important, and that the sort of ingredients that you require for that, they may be simple to get. And at the same time, we know that these societies that are the most successful at achieving resilience are also those that take care of each other, the ones where social cohesion and networks are strong, where everyone not only has access to these services, but they have access to quality services, to the basics. I think that what we are asking also from this forum and from the health sector is that we now do it in a way that does not negatively affect outcomes in the future. And sometimes that short-sightedness that we have about what happens in the next 5 years or what happens within a political cycle kind of gives a barrier to ensuring that future generations have access to quality, good care, health, and the basics. And I think that that's important to really realize, is that we're not talking about today only, we're talking about the future. We're talking about today in what we see in terms of the fires, the air pollution, the issues of ill health that we have because of climate change. But we're also talking about our survival, our quality of life in the next few years, not talking about 100 years from now, right? Mm-hmm. And that we need to start caring for each other in a very different way. I would start with that.
Mm-hmm. Thanks, Diana. I think that's important, isn't it? We're not talking about the future. We're actually talking about now and how we build that future for generations to come. Thank you so much. Fiona, what are your thoughts on this question?
What would a healthy regenerative society look like? I just want to acknowledge that I'm coming from Wajak Noongar Budja, acknowledging, as I always do, that it's what colonisation did to our First Nations. This has led to the problems. They aren't Aboriginal problems, they're our problems. I've got two answers to this in a way. I want a big picture answer. And what I would love as a society is a civil society which focuses on equality and diversity, trust and care, some of the things that Diana was talking about, the collective good, rather than the good that's just for me, valuing parents, valuing childhoods, prevention more than cures, protected environments, safe places for all, effective use of helpful technologies, and child health, as well as adults, child views and needs, as well as adults being taken on. I define this as a civil society, but how do we get there is the one thing that you've got in your question. What are the barriers? Well, we have to shift, I think, from GDP as a singular measure of societal progress and go to a wellbeing agenda. There's a huge national and international interest in this, and that wellbeing agenda should be what's driving decisions rather than the GDP financial bottom line focus. We need to shift the model from Thatcher, Reagan and Friedman, who I blame for Trump's victory, as well as the world that we live in of inequality and huge greed, the capitalism and what got Trump elected. And we need to challenge our health system from moving from clinical care, focusing on the ends of pathways, but now focusing on prevention. And if we'd done that better in the last 20, 30, 40 years, we wouldn't have the climate change we have, because we would have understood the pathways that led to climate change were this extreme capitalist society, and the fossil fuel industry is a great example of how it's just greed that's driving the health problems for the whole world. The other things, I'm going to be very unpopular with the AMA, etc., but I think we need to remove the fee for service in Medicare. It's what's driving inappropriate focusing on ends of pathways kind of care, medicalisation of things like pregnancy and birth and so on. And that would lead to a much better equality for people, because everyone would have access to care without any extremes. And there are a lot of unessential activities in the medical system, which in fact are causing a lot of emissions, wouldn't have to happen. And one thing that I think is absolutely huge is that Indigenous knowledges need to now inform the caring for country and community. And I've just put in a little ad here for the First Knowledges series of books that are put out for the National Museum by Thames and Hudson. They're amazing little series of books on all aspects of First Knowledges. And I've just finished the last one with Sandra Eads and Shawana Andrews on health. And I'm perhaps too naive to think that we could turn back capitalism with Indigenous knowledges, but by jingoes, if we did, it'd be fantastic. Thank you.
Thanks, Fiona. That's great insights. And on that, on that same vein, in regards to First Knowledges, we might go to you, Aunty Doseena, to get your thoughts on what would be a healthy, regenerative and just future. What would that look like to you?
Traditional owners here, but also recognise that our ancestors were full of courage. And I think we have to look at the past, actually. I think we need to go back to see how resilient Aboriginal communities were before colonisation. That's the type of a balanced ecosystem, healthy communities that were sustained for millennium. And as a Aboriginal and Torres Strait Islander, that's where I take courage that our models were back then. And what is the barrier at the moment for us is the intergenerational trauma that we suffer through the trauma of colonisation. And as Fiona stated, the capitalism and so forth, the greed and power that's in society, where Aboriginal and Torres Strait Islanders, and I focus specifically on them, have become invisible. And I think when we become visible and have that equity of power, then there seems to be need to be changed, because we have the worst statistics. First Nation peoples across the entire world. We know the answers, but we lack the power, because, as my son's artwork at the back, that's where I put it, you have two systems, Indigenous knowledge system and the Western knowledge system. And they're two separate, and where they come together in the middle, there's that clash. I'll go this way, is a transformative society. And that is what I look at. Yes, we can't go back to the past, but we can learn. And I think our mob have spoken when we declared the Uluru Statement of the Heart. I think we need to go back and refresh the Australian government. This needs to be addressed and to be high on our agenda, where we need to have that constitutional voice to be recognised, where we need to have a Makarrata Commission where the two parties come together. And when you have that discussion, and I agree with Diana and Fiona and all the things that they've discussed, but I just want to hone in that point. For our mob, that's where trust can finally be, can come, and we can raise our self-determination in our sovereign land. So I leave those little tips there. Further questions I can elaborate.
Thank you, Aunty. I think it's important that we do reflect on that First Nations courage and resilience moving forward into that transformative society. Kate, what are your thoughts in regards to, what does that healthy, regenerative future look like for you, and what are those barriers we need to overcome?
Well, I think Diana and Fiona and Aunty Doseena provided a really strong response, I guess, about societally. Maybe I should just focus in then, I guess, on the health system. So our task is to get to a modern and high quality health, low carbon healthcare system. But there are three principles. There are three ways to do that. And when I'm speaking with our doctors and nurses, I say these are the most important things, and it's pretty reflective of the comments so far. So the first principle is keep people healthy and well. And that, of course, is because one type of system would be a system in which we didn't have any patients. Everyone was healthy and well and independent in their homes and their communities. So it's just in recognition of the fact that many of the people have said that it's about a healthy society, but it's also about, vaccinations and health promotion, obesity policy and tobacco control and all those sorts of things. Those are actually, some of the things that our colleagues are involved in, those are actually sustainability measures. So that's the first thing, and that's always our first sort of consideration. The second one is reducing low value care. We know there's a huge amount of overdiagnosis and overtreatment in our systems, and those things, unnecessary medications, unnecessary investigations, blood tests, x-rays, CT scans, those things have harms and risks for patients, and also costs, not just financial costs, but environmental costs as well. So that's why it's the second principle. Reducing those would be significant. And there's been some research to show that about 10% of care that we provide, this is globally, 10% of care that we provide is actually harmful care. That's where someone goes for an unnecessary test or procedure and they have a poor outcome from that. They get an infection, they get a blood clot, they have a fall in hospital or whatever. And then another 30% of care is low value care. So that is 40% of our care is inappropriate. So reducing that would have significant benefits for the quality and the equity of our health system, and also reduce our environmental impact. So that's why it's the second principle. And then the third principle is saying, okay, where we do have effective and evidence-based care, how do we decarbonise that? And that's about what type of anaesthetic gas we use, how to reduce single-use plastics in theatres, those sorts of things. So I think that having that sort of those three principles is very much what we try to look at, whether we're, talking about, to a renal nurse or an anaesthetist or, indeed our wards people and other staff in the support staff in the system. That's our sort of our whole approach, but it sits within the visions that the other three panellists have outlined, a healthy society. And then in a healthcare system, what does that look like within a modern, more equitable and regenerative society?
Kate, I might just focus in on, you're talking about low value healthcare and how much of that is occurring in a healthcare system at the moment. So I'm going to pose the next question to you, and it's about actually value-based healthcare, which, as you know, is traditionally focused on optimising those patient outcomes whilst managing costs. How would you define value of care in relation to health equity and environmental footprint, and what opportunities do you think we can realise through, reframing those definitions and that narrative?
So in terms of definition, I think value-based healthcare is that's what's valuable, what's useful, what's optimal for the patient. Patients, and I'm often asked, I'm like, well, if it was a high carbon cost, but it's good for the patient, what do we do? Of course we do what's right for the patient. That is our core business. It's looking after people and choosing the best care, the best medication, the most appropriate investigations for them. But the problem is, in many cases, those two things don't line up. It's not what patients want, and it's not within their best interests. And that's really about, increasingly we find, and this is, a junior doctor in an ED department or an orthopaedic surgeon, it's about having a conversation with patients about what is it that they want to get out of it, what are their aims for their life, what are the things that they want to be able to do, and then bringing that lens sort of, okay, and these are the offerings, and this is what, we could do, we could do well for you. These are the outcomes of this sort of procedure investigation. So it's really just it's about spending time with people, listening to them, understanding what they want, and then making that sort of that co-design or that decision about what's good value. And then, the pointy part of it now is that, in New South Wales Health, where I work now, there are increasing number of requirements for us to decarbonise across New South Wales government, and then measuring. We're increasingly now starting to measure the carbon as well, or the environmental impact as well. So we look at like a triple bottom line. What are the health outcomes? What are the patient outcomes people want? That's always our core business. What are the costs? And then what are the carbon costs as well, the environmental impact. So that having that approach, I mean, increasing has been used in the private sector for some time, that people, planet, profit, or that triple bottom line approach. That's the sort of lens, I guess, that we want to bring to our work now.
Thanks, Kate. I think we're, talking further about value of care, I'm really interested, Aunty Doseena, in relation to, how would you define value of care in relation to, with the First Nations and health equity lens? What would that mean to you, and what opportunities do you think we can realise there? Just having some issues with audio with Aunty Doseena. No, we can see you, but we can't hear you, Aunty.
Can you hear me now?
Certainly can.
Yes.
Thank you for sticking with us.
That's
What are your thoughts,
yeah.
Aunty?
Sometimes it's a good thing sometimes it's a good idea not to hear me. Values I place are those deep things that Aboriginal and Torres Strait Islanders hone in on, and that is relationships with our environment. And as Nartarsha had said in her acknowledgement, that it has to be with the environment as well as with us together, with the sea, with the land, with waterways, and with the sky, but also the spiritual connection. That's what I consider values. I agree with Kate. They that you work in, but it is the Western system. I go back to our ways of knowledge, and that is you've got to look at all those things where community is in the hospital system. They're not predominantly. And so where are you most effective? It's on the ground. I'm sure Kate would agree with me with that. On the ground where and for us, it's we are communal people. So how we relate to each other and relate to the environment. Like my daddy used to say, don't take any more than what you actually need. And what you have, you share it around with everybody. So it's a change in attitude initially, and then it transforms into behavioural change. The reason why our people, I'm shouting. Am I shouting? The reason why our people don't come in is because the system, whether it be health, education, whatever, is because it is culturally inappropriate and not culturally safe for our mob. So if you go over that hurdle first, then you get on to what Kate is talking about. And that's where we want our people to go, where the preventable chronic conditions can be cared for. And our self-esteem and dignity can rise up. We have the answers, etc. Give us the encouragement to solve our problems. Give us the resources to solve our problems. And that's why, once again, go back to the Uluru Statement of the Heart. That says it from our mob.
Thank you, Aunty. Some great insights there. I might flick over now to Fiona and Diana. So Fiona, I might start with you. We know as climate change increasingly disrupts our community and ability to deliver care, what are the ingredients to create those climate resilient, responsive health systems? And certainly, taking into account those relationships that Aunty Doseena has just been speaking about and more broader collaboration. What are your thoughts about that, Fiona?
Oh, thank you. Can I just come back to comment on Aunty Doseena's comments? You may think that with this sort of global, greedy, capitalist kind of society with a private system of healthcare, the fee-for-service, all I think that in fact what she was talking about is just unachievable. Let me tell you that not only in our little book, which just came out, but there's a movement. There are movements around not just Australia, but internationally. And one of the most exciting is birthing on country. And Aboriginal ways of birthing are coming back, run by Aboriginal community-controlled organisations. But because of the diseases of colonisation, you can't come back and just say, oh, well, we birth under a tree with our grandmother and our mother. No, what happens is that these Aboriginal-run, the principles of grandmother's way of birthing, all the things that Doseena was talking about in terms of love and trust and care and putting the family in the middle and understanding the culture and the land, all of those things. But they're also having to have the best of Western medicine because of the disease of colonisation, diabetes, rheumatic heart disease, and all these other things. And that's what's happening. And there we had a conference in Perth last year, 250 Aboriginal women presenting about what's happening from Gallowinku down to suburban Melbourne, across everywhere. To me, and when we talked about it with Norman Swan and we described it, he said, gee, that's a health service we'd all like, isn't it? And that's the point. And that's the point of our little book. So it then goes into this question that you've asked me about resilience and how we respond to these changes in our society. And I think that we've now got this national strategy. It was great. I mean, Jed Carney's been wonderful for the midwives as well and the birthing on country stuff. She's been very supportive of that. But we have to ensure as groups, and all of the doctors' groups, all of the nursing and midwifery and other groups across Australia have to ensure the implementation of that strategy. I'm sick of wonderful reports coming out and these people are weak to influence them because they're worried about the fossil fuel industry lobbying or the tobacco industry and all these other things, which are still the most important things that are influencing the health and well-being of our children. So the fossil fuel industry, the tobacco industry, the alcohol industry, the fast food industry and the sugar industry and ad media, that's what's influencing our children and young people and families' health more than any of the research that we're doing. That anguishes me a lot. The kids are now going into Banksia who've had fetal alcohol syndrome and intellectual disability, even though the evidence is overwhelming that that is the most disastrous thing to do. So somehow we have to get more power. Doseena has to be there with us to actually implement the kinds of things that are in this strategy and in the other reports that have been ignored. So I think that is absolutely key. The collaborations question is terrific. And I've got a whole list of collaborations, but I'm probably talking too long. But we have often, I think, that federation is the biggest barrier to health in Australia. But we've got to get the states and territories to work together. We've got to get local government. Some of the local governments are doing terrific things. And they've got to know about this national strategy. They've got to say, well, what role am I going to play? I think we've got to consider the consumer groups, not just our First Nations, but all the other consumer groups who are so passionate about this and to really collaborate with them. And then I just give an example of where we all collaborated the other night. We went to a fabulous public meeting on stopping fracking in the Kimberley. I spoke from the health point of view, but we had Australian Conservation Foundation, Doctors for the Environment, the Kimberley Environment things. We had Greenpeace. Everyone was at that lobby, at that talk. It was absolutely overwhelmingly exciting. But I think also, we've got a lot of lobby groups. Somehow, collectively, we've got more power. And I think that's because my major thing, of course, is stopping the fossil fuel. So, sorry if I've been all over the place, but...
That's wonderful. Thank you so much, Fiona. And Deanna, I'm really interested to hear from you on Fiona's thoughts as well, because you really bring us the global perspective into our panel today. So in your view, what are those ingredients to create that climate resilient and responsive healthcare systems globally?
Thank you for that, Athena. And I like how this question comes to about ingredients too, right? And I'm fascinated about this because worldwide health systems are very different and they have very different values. I love that Kate was talking about patient outcomes, right? That's definitely one that you have across the line. But in some countries, including my adopted country, one of the values is, for example, patient preference. which can be a very strong ingredient, and also one that just kind of scapegoats and greenwashes things. Because you give the power to people, but people who may not have been educated on the choices they can make, or that are actually given choices that are low value, right? Because we don't start from the beginning. The question I hate the most when somebody asking me, where do I start? Tell me what are the solutions, I'll go and do them right now. And I'm like, that's impossible for me to tell you. I have a global roadmap here that has a bunch of different actions that you can take, but it is skewed because of where the data is. Where is the availability of data? We know about energy. We know about certain types of consumption of some of our health supply chain, but we know a lot less about what might be the cost savings and implications of really and truly looking at the efficiency and the effectiveness of health systems and how those may reduce carbon and greenhouse gas emissions, for example. Now, in terms of climate resilience too, I would say a few things. The first one is, the sooner that we decide that we cannot be talking about adaptation here and mitigation over here, the sooner I think that we'll get solutions off the ground in a much better, bigger way, and better outcomes overall. We have the separation of things that we've created, and that make it extremely expensive and difficult to think. You're almost like a checklist. I am either doing adaptation or I'm doing mitigation. Why is that? We created that. The truth is that while some solutions speak against each other sometimes, like one of the solutions for adaptation might be actually a high carbon solution, the truth is that there are plenty of solutions out there that can speak to both. And why don't we start there? We know that we cannot adapt ourselves out of this problem. And sometimes focusing so much on adaptation and equating that to resilience, I think is a very dangerous thing to do. The second one I want to speak to also, Fiona was talking about this power of collaboration. And I think here is where we are forming a whole cohort of health leaders here, right? And it's important also as health leaders to eat a little bit of humble pie, because we are not the only ones in the room. We may know what's important to the communities we serve. We may know what is important to our patients, right? But at the same time, there's a whole other set of actors in different sectors that have been given a very different agenda, and making sure that we're bringing that in a compassionate and important way in which we can include ourselves in those conversations is important. Health in all policies is one way to do it. I think Michelle talked about this in her opening, and also making sure that we are connecting with those sectors in very different ways, local ways, governmental ways is very important. And then I want to speak to also about these localized solutions. I think that that's hugely important, spoken about by Aunty Doseena and by Fiona herself. I think that really understanding not only the vulnerabilities themselves, right? Really asking ourselves the hard questions of why are people more vulnerable? Why is that? And also understanding what have been the solutions in those contexts. We have quite a few examples of how hospitals, health systems have been looking at using their ecology, where they're situated, and traditional knowledge about how to have better ventilation, for example, how to build buildings in certain climates. Those are things that are important and that we do not always consider when we're looking at globally, because we're looking at a big picture. But those contextualized solutions are incredibly important, particularly when we're looking at quality healthcare from an equitable point of view.
Thank you, Diana. It very much, lends itself back to the, think globally, act locally, isn't it? And really contextualize those solutions. And as you said, plenty of solutions to our context. So thank you. Look, we've only got a few minutes left, and I'm going to go around for our entire panel to comment on this. And obviously, we've seen very much in the last week and even prior to that, a shift in our political landscape. So my next question is in regards to that. So in the face of that shifting political landscape that affects our climate and health priorities, what strengths do health leaders bring that can really drive us forward? And can you share any examples of what's actually motivated you in your work? Because I know sometimes, certainly being in this space too, it can be at times easy to lose hope. But let's focus on moving forward and how we can do that. So I might start with you, Aunty Doseena. We've got audio again, Aunty.
Again? Oh, I think people don't want to hear me.
We love it.
I've just that's right. I'm talking mainly to non-Aboriginal and Torres Strait Islander peoples now. The greatest thing you can do for us is to become an ally, to learn, because the no referendum certainly show that we don't have many allies, but we are hoping now that through education, to really listening, that we can build that allyship. So there's advocacy in terms of non-Indigenous people. In terms of our mob, it's again our self-determination, advocating for our people and having that freedom, that voice. We need to connect back to our culture. We can have a strong identity and have that sense of belonging, which was taken away. That's, as a leader in our community, that's our greatest hope. How do we bring back those very basics? Yes, there's a system out there that the other three ladies have spoken about, but for our mob, it's back to the basics, where it was harmed so greatly in order to destroy us and take our land, etc., etc. And Fiona spoke about birthing on country. There are heaps of other examples, but they're never advertised. Mm-hmm. And I went around the world and I found examples in all First Nation people, in Aotearoa, in just Canada, over there amongst the Sami people, amongst the Frisian people in the Netherlands. They have got really good examples when they go back to ceremony, when they learn language, when they go back to their country. And you need leaders to do that, leaders who haven't died off, elders who haven't died off early, and that's where we're trying to get the health system in there so that their age can increase, the lifespan can increase, and they can pass that knowledge on to our young people, who will be the takers into the future. I think that is the way that we can, as Indigenous peoples and as allies, help our mob to bring that approach, which involves culture and the spiritual. For us, the spiritual is far greater than what we see physically. So often into the health system. Aboriginal and Torres Strait Islander peoples, what the spiritual means for them, and respect.
Thank you, Aunty, and you're certainly with strong allies in this virtual room, Aunty. All right, we might go to Kate. Kate, how do we move forward now in this political landscape?
Yeah, I mean, a pretty sobering couple of weeks, obviously, for everyone. I think you asked about strength. I think the great strength that we have is that actually people care about cost of living and the economy and so on, but they also care about health, and the climate health impacts are significant. People care about their child's asthma during bushfire events. They care about their elderly parents during extreme heat. And if we can make that very strong case about the health-climate connection, I think that's really important for us. And we are good spokespeople. Health professionals are the most trusted and respected professional group in all of society. We actually have huge leverage and influence if we used it much better. And then I think you asked about sort of my story and what drew inspiration. I was a junior hospital doctor, was going to be a physician, got frustrated with clinical medicine, to be honest, and got interested in public health medicine. And I remember doing my master's, and I still kept my hand in clinically. I was still working in the hospital because I was sort of hedging my bets a bit. But I did a master's of public health and worked with some of the great tobacco advocates in Australia. And I remember thinking, these many more lives than any cardiothoracic surgeon I know. So that the impact of the profession and the advocacy and things that we can have, just as we had on smoking and seatbelts and other areas, Fiona could talk, for hours about that, but that is now what we need to bring to the climate debate, that professionalism, that influence, and that making it tangible for people. This is actually about their health and safety of their family and their community.
Absolutely. Thanks, Kate. I know we've only got a few more minutes, but would still love to hear from Deanna and Fiona. So Deanna, over to you.
Thank you. I think I go back to kind of what led me to this point, right? And it was when I was working on climate resilience and food security in East Africa and actually in quite a bit of the Africa region. And I had done so many theories of change for projects in development, so many. And all of them kind of, as soon as you're putting together a problem tree, it kind of went back to the key problem that was climate change. And the question that I always got from these frontline workers, right, that many of them were working in the NGO sector, but they were also extension workers for their governments. They knew what the communities were suffering. They were themselves part of those communities. And they always asked, well, Diana, we're doing all of this work over here, but what about here? What about really tackling the problem here? And unfortunately, because of where the money was coming from or where the project objectives were, we could never really tackle it. And that great kind of frustration and really, trying to make a change to that. And I changed a bit my pathway to get to where I am today. But that kind of continues, because when I hear from health professionals, and not just the doctors and the nurses that work in a facility, right, but also community health workers, and when we're talking to them, it is clear that they care about their patients, that they care about the communities where they serve. They know what the issues are beyond the fact that they may, their patients may need medicine. It is incredibly sobering, is incredibly motivating to me as well, to continue in this work and to continue to provide the tools and guidance that they may need. Just recently, we're at a conference. Sometimes you go to conferences and you don't know what you're going to learn. But to be very honest, I was just at a conference in Southeast Asia, and one of the one person who works for our Ministry of Health, who also is a doctor, she came over and she said that after that conference, she was so excited and motivated to work with other health professionals in the region, that she had made so many connections. And I really hope that that also is something that you as an audience here today can get away from this conference. A sense of grounding, but also a sense of moving forward in what you can do, because there is only so much we can do and kind of what we can control. There's also so much that we can do together and with other sectors. And I hope that you come up with that today and the rest of the week.
Thank you so much, Diana. Fiona, what wise words are you going to leave us with? How do we move forward? Tell us.
I know we only have a second or two, but it's just that it seems to me that whilst everyone's very depressed about the political changes in the states and the fact that our governments aren't responding, particularly in Western Australia, to the fossil fuel disasters, that it's incredibly important now that we work together more effectively. I think that Trump's election win is going to mean that we're going to work together in communities more. We're going to get more powerful groups, because we're all frightened. We're frightened of what he's going to do, and we're going to counteract that. And I think we take on the First Nations policies that Doseena's talked about, even think how powerful we are as health professionals. Don't forget that, and use that power. And you can't just do cardiac surgery, like Kate says, and not think that the most important thing you could do to improve the health and well-being of your patients is to actually stop the climate change with fossil fuel emissions. So I'm loving working with all the young people. I'm not quite yet in Extinction Rebellion, because I think probably that's not getting there, but I'm almost there, because it's just so important that we put ourselves out there. The more we can get our leaders, our young people, our Aboriginal people to really work with us all together. I think we're going to do it because we're scared of the Trump victory. And just the one example, remember the Lancet Commission and what that did. So they're the sorts of things we need to redouble all those sorts of efforts. And our leadership should be saying to governments, health and climate needs to be in the economic bottom line of every decision that you make.
Absolutely.
Thank
Thanks,
you.
Fiona. And I think, I know that our shared values certainly have been challenged, particularly in the last week. But the thing that I'm noticing now, actually, now that we've sort of grieved, that we're coming together, and we're coming together really strongly, and knowing that we are working together and we do have a way forward. So thank you so much.
Can I just say one more thing? I know we're running out of time, but just to say to Doseena, 6.5 million people voted yes. And after that, I have sensed in the community that I work with a huge resurgence of Aboriginal knowledge coming into various communities. So please take heart. We love you. We're allies. And we have so much to gain from your wisdom. Sorry, I know we're out of time.
No, beautifully said. Thank you, Fiona. Appreciate that. And thank you to all of our panel members. You've been so generous in sharing your experience and thoughts with us. This will bring us to the end of the session. Just a few little messages I want to leave you with. Check out Bupa, our main sponsor's stall. The team's available to chat to you now in between our next session. So please make your way over and say hi. You'll also notice there's a little button that reads event streams. That allows you to post an update or an image or to respond to others. So please feel free to post there. If you're holding a group viewing session, we'd absolutely love to see your setup. And don't forget the hub, the meeting hub, it provides an opportunity to connect with each other. And as Diana pointed out, whilst we're meeting virtually, we're still together, so it'd be really good to connect. So thank you so much. A strong start to the start of the forum, and we're looking forward to what the next 2 weeks will hold. Take care, everyone.